This is Ken. Anita. There you go. I'm going to make sure that
Sorry, I just
No.
making sure I can get access. Is Melissa on yet?
I think she's just coming from the other meeting. But Nita, thank you for doing this. And please introduce yourself because people should know who you are and how important you are to the N3C team.
All right, so yeah, hello everyone. This is Anita Walden, I'm Assistant Director for CD2H. And so what we wanted to do today was to give you guys kind of like a high level overview of the N3C Enclave. And so what we're gonna do is, next slide, we're gonna take you on a tour. And so Dr. Hendel, Melissa Hendel is gonna talk to you about the N3C cohort. And then after that, Vera Gabriel is gonna talk about the data that's in the N3C Enclave. And Ms. Yudi Shea will give you actually a tour of the homepage. So when you first go into the Enclave, you'll have like a landing page. And so she's going to just show you around that, show you the different resources that are available to you. And then after Yudi finishes, then Mr. Benamor will give you a demonstration of the N3C Data Enclave as far as once you get access to the data, what your home space might look like, what artifacts will be there, like how do you get your data elements, how do you share data elements, but it'll just be a high level overview because we'll have training. And then after he finishes, then I will talk to you about just how to get started. And so that's the plan for today. We have about 30 minutes of presentation. If we complete in time, we'll take a couple of questions. And is Melissa on? Because she is up first.
I think she's still coming over. Maybe I can be the ugly substitute,
Okay.
Anita.
All right, so we'll just go ahead and move on. Next slide.
So Melissa's here.
Okay. Right. So Melissa, if you're on, you're up.
Hi, perfect timing. Hi everybody. We have double booked for 2 different CTSA meetings at the same time. All right, so I'm just going to give you a few opening remarks about the National COVID Cohort Collaborative and where we're at with things. So next slide, please. So I just wanted to, this slide is both a sort of, you know, kind of a perspective on where the N3C is at, but it's also a testament to the CTSA program itself and the community. You know, it's really incredible how much has been done in this time. You know, we kicked off the N3C in April. It was really with the help of the CTSA steering committee that we kind of, you know, really helped get this launched. And very quickly now, we don't have the numbers for January yet, but we have currently 2.7 million harmonized patient records in the system with, I think we're up to 78 now, data transfer agreements from different institutions, which obviously includes more than just the CTSA program, and have been working really actively with many CTSA partners to bring in other kinds of data. And the papers are really starting to flow. It is really a village endeavor. And, you know, as far as I know, it is now the largest limited data set in US history. And it was built, you know, for the CTSAs, by the CTSAs, but also for the community, a scientific community writ large. Okay, next slide. So this just gives you the actual numbers and some projections based on the current data transfer agreement. So we're up to 500,000 plus COVID-19 positive patients. So that's a very significant number, with 39 sites have data that has been harmonized. And that's 3 billion rows and 220 million observations with 153 million visits. We are anticipating with the number of DTAs that have been signed, approximately 7.2 million total patients. We hope that more sites will sign and the number will be even larger, but we've really benefited from the partnerships across the clinical research communities in order to make this possible. And we have over 1,200 participants and 91 project teams working on these data already. I think those numbers are already out of date. So again, it takes a village, and we're really grateful for everyone's participation. Next slide. So I just wanted to give you a very, very quick overview of what we call the cohort paper. This is a cohort evaluation that sort of just really kind of characterizes the cohort in a really robust manner after kind of harmonizing the data and really thinking about how we can, you know, ensure that we're asking the same question of all the different sites' data. And so you can see over on the left, we've implemented a severity scale and classified the patients in the different categories over time. Over on the right, we have some different medication usage, and you can kind of see the trends over time. So for example, systemic antibacterials have had a trend downwards, whereas we have an upwards trend with remdesivir. And you can do these kinds of evaluations for the different severity categories and look to see also across different regions in the country how different drug regimes have been applied. And this is now available as a preprint on medRxiv. If you go to the bit.ly/cohort-preprint, you can actually look at a lot more information about the cohort at that link. Next slide, please. And so this is just one of the outcomes, and I just wanted to acknowledge Dr. Tel Bennett from University of Colorado. He couldn't make it today to present this work, but he really led this analysis. And one of the really cool outcomes was a first day machine learning model to predict patient severity. So using all the different harmonized variables, which you can see over on the right, we look to see which types of machine learning methods and which variables would be most predictive of patient outcomes. And it turns out that things such as pH, age at visit, respiratory rate, oxygen saturation, blood pressure, et cetera, were all commonly available measures that were available on the first day, and also really important for underserved communities, which may not, so this type of machine learning predictor can actually be deployed in really any hospital setting. So we're really excited to see this type of large scale data be used to build a very useful clinical tool. Next slide. And so I just wanted to quickly go over the different types of data in the system. We have 3 levels of data. We have a limited data set, which is available to researchers from US-based institutions. This data set contains dates of service and the patient's zip code. And this is the data that we most protect with a human subjects research training and local IRB determination letters, which are required for requesting access through a data use request through the Data Access Committee. The level 2 data is a de-identified data set, which has the dates of service algorithmically shifted and the patient zip codes are truncated to 3 digits. And this does not require IRB approval to make the request to access these data. The level 1 data is synthetic data, and it does not require either human subjects research training nor the IRB approval, and is really available to almost anyone from not only US-based institutions, but also foreign institutions and citizen scientists. And we're really excited to have even high school and college students working with these data. So it's also a great learning opportunity for students. Next slide. So I'm going to hand it off to Devera Gabriel, who's going to speak a little bit more about the details of the N3C data and the harmonization processes.
Thank you, Melissa. Good afternoon, everyone. I am Devera Gabriel. I'm with Johns Hopkins University and a member of the N3C Data Ingestion and Harmonization Workstream. I'm going to share with you today just a few details about the data in N3C. Next slide, please. In N3C, the data being gathered from data partners has changed over time as the pandemic has unfolded and testing and cases have risen dramatically. A dedicated team of specialists work with each site to facilitate all of this data collection as a service. Currently, data are extracted from confirmed COVID positive patients with records spanning back to January of 2018. To support comparative analyses, the phenotype and data extraction team is also collecting data for demographically matched control patients in a 2-to-1 ratio. Phenotype descriptions and scripts for sites to extract data, customized for each contributing common data model, are kept up to date and available on the N3C public GitHub repository. Next slide, please. The data ingestion and harmonization process is a complex set of procedures that forms a pipeline that is a key component of the N3C architecture. The underlying goal of the pipeline transformations are to support uniform access and utilization of the extremely rich data in the Data Enclave for analytics. And much of the harmonization effort involves preparation of the data for ease of use by analysts. The pipeline achieves a common data model to common data model harmonization, which leverages established federated networks who, in contrast, perform EMR to single common data model data extractions. There is a powerful data opportunity provided in centralizing patient-level data by processing payloads through a single harmonization pipeline. This makes it possible to achieve discovery based on associations among the data, machine learning, and other advanced analytics, in addition to questions supported in a federated network architecture. At this time, N3C is dependent upon 4 communities and their common data models, provided by Odyssey, PCORNet, the ACT network, and Trinetics. By working in partnership with these communities and leveraging their common data models, N3C has been able to quickly aggregate the OMOP-based centralized data set and process data through the ingestion and harmonization pipeline. Each step in the pipeline checks aspects of the data and provides alignment through transformation of source data that are non-conformant to the N3C OMOP implementation. This includes things like interpretation of qualitative COVID results, such as presumed positive or negligible, and transforming these expressions in the data into positive or negative, or alignment of units of measure to a uniform set for lab results. Transformations baked into the data harmonization pipeline have been carefully curated based on extensive manual review by groups of N3C clinicians, common data model, and data science subject matter experts. Additionally, site data payloads that are contributed on an ongoing basis and refreshed in the enclave through the pipeline are reviewed by a team of subject matter experts using robust data characterization and quality visualizations before being released for use by researchers. Next slide, please. Whereas there's much focus on work on alignment and harmonization of the incoming data, there are some known persistent data issues which are documented and available in the enclave so that researchers are aware of any potential limitations that exist when performing analyses. Sites collect data in their EMRs differently and also transform their data to contributing common data models differently. As such, site-specific variations are noted in the ingestion and quality review processes and provided as reference documentation for researchers using the enclave. Level 2 access data processing performs data obfuscation as a procedure to ensure privacy requirements, as Melissa alluded to. This can impact time-based analyses in the level 2 data sets. Some common data models have required data classes and fixed value sets. These are not necessarily required nor contain the same values for classes in each of the other common data models, and this can create a systematic missingness or other common data model-based data features impacting some analyses. Data commonly found in EMRs may not be available in common data model implementations. This includes things such as ventilator utilization and advanced directives. And lastly, certain data require code workbooks or calculations in the enclave to identify them. This includes BMI, inpatient encounters, and certain clinical cohorts, such as pregnant patients. I hope this has provided some insight to the very rich data set we've amassed in N3C and the complex processes which comprise the data ingestion and harmonization pipeline. Now I will turn the presentation over to Yudi, who will brief you on the Data Enclave homepage.
Thanks, Devira. All right, so I will be doing a live demo of the homepage and walking you through some of the features. Can everyone see my screen?
Yes, we can see it.
Great, thank you so much. All right, hi everyone. Thanks so much for spending your time here with us today. My name is Yudi. I'm a technical project manager at Sage Bionetworks, and I'll be walking through some of the N3C Data Enclave homepage features today. All right, so when you first land on the Enclave homepage, you'll see several navigation menus along the left, along the top, and the What Would You Like to Do section here. I'll be doing a brief overview of the buttons here and a few of the items along the top. Below here is the live count of the data that's currently in the N3C Data Enclave, which Melissa shared a snapshot of at the beginning. All right, so from the What Would You Like to Do section, you'll see 4 buttons: See My Projects, Request Data Use, Explore Projects, and a Quick Start Tour. For the purposes of this demo, I'm going to start with the Explore Projects button, where you can see the current research and operational projects already in the enclave. So projects which support request to join are listed in the first section. In the middle are projects that you can't request to join, but may still want to read about. And below are operational projects for use by N3C internal teams. There are a lot of projects happening in N3C, so you should browse around the domain teams and this project list to see if any potential projects already match what you're interested in. You can use the request to join button at the end here to begin the process of joining that project. Please note this interface is a little cramped, so notice that the columns are sortable and there's a handy search feature at the top. Okay, so what happens if your topic of interest doesn't have a project yet? You can propose a new project space as the project lead. To do this, we're going to go back to the landing page. And you'll want to submit a data use request, also called a DUR. You can get to it by using the Request Data Use button here. So the public N3C website has a detailed checklist that you can use to make sure you have everything you need to fill out a DUR, also known as a data use request. Moving forward, I'll be referring to it as a DUR. As an added note, please be thoughtful in your response to these questions, as DURs are difficult to modify after the fact. And whether you would like to create a new project or join an existing one, you'll need to complete one of these. All right, so while you wait for your DUR to be approved, there are several other sections of the homepage you can explore. Within the Data tab up here, there are links to the Synthetic Data Release Notes and the Data Enclave Release Notes. The training section contains a wealth of information in the form of documentation and self-guided tours. However, these don't pertain to N3C data. For that, we've created a training portal which covers N3C specific topics, including OMOP and code workbook templates. And at any point, if you run into questions or issues, you can go to the Support and Contact tab. Here you have several channels of receiving help. For data and enclave specific questions, please use the internal reporting system. Okay, so once your DUR is approved to create or join a project, you can use the See My Projects button under the What Would You Like to Do, this button here, to see a list of all the projects you're a part of, as well as their approval status in the interim. All right, and that's all for the quick tour. I'll hand it off now to Ben, who'll give a more detailed look into what it looks like within the enclave once you have your project workspace approved. Thanks, everyone.
All right, thanks, Yuri. Let me know when you can see my screen. Does that look good?
Yep, we can see it.
Perfect. Okay, so I'm going to start here where Yuri finished on the homepage, but I'm going to have a look at the Discover tab. And so there's some useful links from here to some of the key tools that you should find pretty useful inside the enclave. So firstly, we have the data catalog. So this is a place you can go in order to browse through all of the data that is available to you in the enclave. So if I follow that link, that's going to open up a view like this with various different collections of data. And you'll only see the ones that are accessible to you. So you'll probably see fewer than this. But if you have access to the LDS data, you will see that. If you have access to the de-identified data, you will see that. And then there's also open source data. So there's data related to social determinants. There's synthetic data that you can use in order to sort of test things out if you haven't yet got access to the real data. And inside these collections, you can see each of the data sets that are available, and you can start importing into the different analysis tools. And for each of these, you can see the columns and the schema and some information about each of those different data sets. So if I go back to the Discover tab, we've also got these two applications here, which are really useful. The first one I'll take a look at is the concept set browser. So what is a concept set? This is the term that OMAP uses in order to describe code lists. So it's essentially the list of codes that we need in order to define the particular condition or measurement or procedure or medication that you're trying to find in the data and ask questions about. And if I open up the concept set browser, we have nearly 1,000 concept sets that have now been defined by users and that are available for anybody to access and to start using in their own analyses, which means you don't have to start from scratch. And so, for example, the cohort paper has produced a large number of very useful concept sets that's been used to produce the results that Melissa was describing earlier, and those are available for you to start using straight away. And as an example of this, I'm going to take a look and see if there's any concept sets for remdesivir. So if I wanted to do a project related to looking at patients that received remdesivir, this is where I would need to start. And we can see that there's actually 3, and in fact, one of them was produced by Devera, and so automatically we're going to be trusting this one. And I can see this one has actually been marked as finished. So I'm going to take a closer look at the code list here, the concept set for remdesivir. And if I click that link, that's going to open up this view, which is a very rich view of information about all of the different codes corresponding to remdesivir. And we can see there's actually 2 versions of this. The first one was made by Devera, and then the second one was updated to add a few more codes by Tel, who, as Melissa said, was the lead PI on the cohort paper. And if I want to actually see all of the codes that are included, then I can follow this link. And that's now going to show me the actual 46 different codes that was included in here. We can see they're mostly RxNorm or RxNorm extensions. We can see a full list here. And what we can also do here is actually start to understand how these codes are being used within the actual data. And so this is a heat map that shows us of these 46 codes, which ones are actually appearing in the data, and how does that vary across sites. So along the x-axis, we've got each of the individual sites, and then we have the different codes. And then we can see, for example, site 688 has a large number of nearly 2,000 patients with a prescription for this particular version. And we can flip that over and look at it from a percentage perspective as well. And so this gives us an idea of whether the code list we've created is actually capturing as many patients as we would expect. So going back to the Discover tab, we've also got the knowledge store. So the concept set is a place where you can go to find code lists. The knowledge store is a place where you can go to find much richer and more complex sort of logic or definitions. And so that might be things like cohorts of patients, key variables like outcome metrics such as severity, and other key data elements. And so if I follow that link, then that's going to open up a similar kind of discovery tool where I can filter down to look at logic that's been produced by particular projects. So in this case, again, I'm going to look at all of the different knowledge objects that the cohort paper has put together. And so we can see, for example, that they have done a lot of work in selecting the critical visit for each patient. So that's the visit that is associated with their COVID positive test. They've also done a lot of work to define various different severity and outcome scores. So looking at different outcomes such as AKI, ECMO, and various things like that. And they've also done a lot of work to define the core sort of labs and medications. And all of that is also available for you to start consuming. And so, for example, if I want to ask a question now that relates to remdesivir and patient severity, then I could start to bring in these data sets that contain that information into my own analysis. And so just to finish up of what could a very simple analysis look like that used these various things we just explored, I can go to now a workbook environment, which is where I can actually start to develop analyses, more complex analyses. And what we can see here is we have one step here where I actually just brought in this form. So I didn't have to write any code. I brought in this form and I just pointed it. I can search again across all of those concept sets and say I want to bring in the remdesivir concept set and filter down my drug exposure table to that specific set of prescriptions. And then I also imported that data set with all of the outcome scores from the knowledge store. So I just brought that directly in. And then I did a couple of simple steps where I brought those two together and looked at which patients had received remdesivir, and then did a very simple chart here. So this is a sort of a point and click tool for making line charts and bar charts to look at the number of people that who were hospitalized that did not receive and did receive remdesivir. And now if I want to start to create a report, then I can use this button here and I can start to build up some nice visual reports that I can share with my collaborators. So there's lots more. I've only just really sort of scratched the surface, but hopefully that gives you an idea of some of the tools that are already available for you to start using.
Thank you, Ben. All right, so we just looked at the data, but I think one of the most valuable features of N3C is the community. Next slide. So, and click one more time. There are many research teams that have organized around the research questions, and click one more time, performing team science. And these multidisciplinary teams consist of clinicians, they have statisticians, informaticists, people from industry and the community. We also have individuals who are part of these teams that have experience in navigating the enclave, as Ben just did. They can also talk to you about the terminologies, help you understand the data, help you actually create your data sets, and help you with designing the code sets. So there's lots of help here. In fact, if you want to know a little bit more about how you can work with a domain team, we have a clip on the website. Dr. David Ellison, who is a clinician, he's director of the Oregon Clinical and Translational Research Group here at OJSU. He's on the AKI domain team, and he gives a brief description of his experience. So feel free to go to the website, click on his short, brief message there, and you can learn a little bit more about how to work with domain teams. Next slide. So we do have quite a few domain teams. You could check on the website to see, to get a complete list, but some of the domain teams we have are around pediatrics, pregnancy, social determinants of health, critical care. And if you don't see a domain team there that you're interested in, you can create your own domain team. So we have a brand new domain team that's getting started. It's a nursing group. And so we hope by February they'll be up and going, but you can do the same thing too. And I'll talk to you just a moment about actually how to do that. Next slide. And so there are some other benefits to N3C, such as training opportunities, especially for the KL2 and TL1 scholars and other graduate students. Also, if you're interested in learning new techniques and skills, there's an opportunity for you too. There is pilot data here. There's an opportunity to collect pilot data, especially for grant submissions. If you have an algorithm that you're using locally, but want to train it on a larger data set, this gives you an ability to do that too. Also, with the N3C community, because it's so rich and diverse, there's subject matter experts there. So if you don't have a certain subject matter expert locally, there's a chance there may be one-on-one domain teams. Also, this is a great opportunity for accessing EHR data. Sometimes we may not have access to our own EHR data locally. This gives you access to EHR data. It also gives you access or ability to learn how to use tools on large scale data, especially COVID data. Next slide. All right, so Yudi talked about the projects. We do have a list of projects on the website that are available in the Enclave. There are projects that are available and open for collaboration. If you happen to see a project that is not open for collaboration, we do list the lead investigator. So you can always reach out to them and ask if you can collaborate with them. And if so, we can arrange it so that way you can join them. All right, next slide. Here are some of the resources that we have. So if you do want to start a domain team, there are resources in our admin core to help you get started. We can create a workspace for you on our Google Drive. We also can create listservs for you, a Slack channel so you can communicate. Also, there are tools and templates that the different domain teams have shared, such as IRB templates to help you with your IRB submissions if you need that. So there's plenty of support, and also there's training. And so in a minute, I'm going to talk to you a little bit about some new training that's coming up. Next slide. All right, you've clicked through this a couple of times. All right, to gain access to the Enclave, there are 3 things you want to do. You want to actually get a data use agreement in place with NCATS. You want to register and also create an account. And then you also want to submit your data use request. So those are 3 things you need to do. So if you don't know if your organization has a data use agreement, you can go to the N3C website. On the website is a list of all the organizations that have a data use agreement. If you do not see your organization listed there, then there's a link to go to the NCATS website in order to start working towards setting up a data use agreement with your organization. Now, once you get your data use agreement in place, you can actually create an account and get access to the data. To do that, there's some security training that's required by NCATS. It's pretty easy. It's online. It's pretty simple. But one of the other things we have done, next slide, is we created a checklist because, as Judy mentioned, there are a couple things that are needed in your data use request form. And depending on which access of data that you need, you may need to have additional information. So look at that Enclave checklist. It will tell you everything you need to have depending on the access you need as far as how to complete that request. But if you still have questions, we have plenty of support for you. So we do have training office hours twice a week, Tuesdays and Thursdays at 2 p.m. Eastern time. You can join those office hours. Our N3C training coordinator, Sean, will be there to help you. We also have orientation that has been scheduled. So we just kicked off new orientation, and I'll go through that in a moment. And then, as Judy pointed out, there are tutorials available in the Enclave, and we have other training too that's available online for you to take. Next slide. All right, here's the orientation session I was mentioning. So the upcoming orientation that we have is Tuesday, February 2nd and Tuesday, February 9th. These are session A and session B. Session A is kind of like an overall tutorial about the Enclave, like how to get started, actually help you with your DUR, and those type of things, and how to get involved with the domain teams. And in session B are for those people like once you submitted your DUR and have gotten approval from the Data Access Committee, then you'll need to learn actually how to navigate at a deeper level. And so session B actually covers that information. So just look at these days. We will run these sessions ongoing, I think like every other week. And they're not recorded yet. We were trying to decide if we're going to record these, but it's best to probably be there. They're interactive. That way you can ask questions and get answers to your questions. All right, next slide. All right, so next steps for you. Check out the resources we discussed today. If you haven't registered, please register. Visit the N3C website, especially the domain team page. And then once you get access, take a look around. Look at go into the Enclave, browse around, look at the training resources that are there. And if you have any questions, we're here to help you. And we have a support desk that you can contact too for any questions. Next slide. And as was mentioned before, if you're interested in the operations of N3C, we have a number of different work groups and subgroups that you can join. It's open to anyone, and you can help us actually create and help us operationalize this initiative, this effort. Next slide. All right, so I think we have time for a few questions. So I see a question that says, if we got our DUR before session A, can we go to session B? Justin, they like for you to attend session A, but I think in your case, it's probably fine to go to session B. The reason why they have session A as a prerequisite is because there's just a lot of background information that will help them in session B, but I think we can make exceptions. Are there any other questions?
Anita, do you want to speak to some of the more advanced trainings that are available? It's hard to do everything in a short period of time.
Right, so there is more advanced training, and Sean is in the process of putting together some of that training, but some of it's also available within the Enclave. Ben, I'm not sure if you are aware of which training is available currently in the Enclave. Do you have any comments about that you want to share?
Yeah, I mean, so if you go to the training module section that Yuri showed, that's a link to from the homepage, there's maybe 6 different modules of sort of increasing complexity. So it goes from basic navigation and simple analysis through to how to use the concept set, how to build your own concept sets, how to use the knowledge store, and soon there should be one on how to use the more advanced analytics capabilities. So all of those are available as sort of written or walkthrough tutorials in the Enclave.
Right, and we also have OMOP training. So the data is an OMOP format. And so to use the data, you'll probably need to know a little bit more about OMOP. And so we do have training available. We have some online training sessions. OMOP has lots of training, but we can also help you with that too.
So I can answer Svetlana's question about team science. So the slide that Anita had shown, we really envision the CTSAs with their core functions and the communities that work with those core functions within the CTSA as really being nucleating functions for projects relating to COVID in the N3C, because it really takes expertise in study design, biostatistics, informatics, clinical research, and the physician scientists. And so there's many different areas of CTSA expertise that are really, really important to work together. And we found that the domain teams that have that spectrum of CTSA expertise have really been the most successful. So we would encourage you to similarly kind of think about your own CTSA as sort of a rounded project as a mini domain team by bringing people together with different areas of expertise.
All right, any other questions? All right, Melissa, anything else you wanted to add, or Ken?
Anita, I want to give a special shout out to you. Anita has been one of the major forces behind this and has organized so much of this, and we all appreciate it so much. And obviously to the CTSA community, because this, to imagine that we could have over 1,200 volunteers working on this is pretty impressive, well, what the CTSA can do. So I just want to thank everybody.
Yeah, I'd like to echo that sentiment. This really is on the backs of so many different contributors, and it's really exciting also the way in which the system, which we didn't have time to go over, can attribute everyone's contributions, everything from the data contributions to the analytical components. So again, we're really excited to have participants at all career levels from all disciplines, and working together has been probably one of the best silver linings of the whole pandemic.